Hello, and thank you for your interest in the VCMA virtual group for 2020. I'm Catherine Hansen. Many of you know me, and I'm going to provide an overview. I have got my email address there, and you're welcome to send me emails if you have any questions on this presentation. There is a deadline coming up very soon in the next couple of weeks to get your application in, so please send questions if you have them. So what is a virtual group? Well, a virtual group is basically a group of physicians who are in separate practices who decide to come together to be part of a virtual group for the purposes of MIPS. So there has to be 2 or more TINs, and all of the people in the groups that are in the virtual group must be fewer, either 10 or fewer clinicians. So basically, if you have 11 doctors in your group, then unfortunately you cannot be part of a virtual group. But if you're a solo or small group with fewer than 10 or up to 10, then you can be in the virtual group. And to be a MIPS eligible clinician, you must have more than 200 Medicare fee-for-service patients and more than $90,000 in Medicare Part B allowable charges, and also more than 200 Part B covered professional services. But basically, everybody will meet that final criteria. So you need to, as a matter of the TIN and who is billed, that's where you have to have at least the 200 Medicare fee-for-service patients and the $90,000 in Part B allowable charges. Okay, so why would you want to be part of a virtual group? Well, probably the most important reason is because you can use the web interface reporting. You cannot use web interface reporting unless you have at least 25 MIPS ECs in a group. And so the only way that doctors in smaller practices can take advantage of web interface reporting is by joining a virtual group. The nice thing about the web interface is not only are most of you already well versed in that because you've been using the web interface reporting measures now for several years as part of either the VCFMC or the Memorial Hospital's ACO, but also it means that you're only going to have to report on those Medicare patients that CMS samples. If you are in MIPS generally, for 2020, you're going to have to report quality measures for a minimum of 70% of all of your patients, regardless of payer. So obviously, the volumes go up dramatically when you're looking at your entire patient population. In addition, if you are a specialist, generally speaking, you will not have any quality reporting obligations under the web interface because those measures are primarily relevant to the primary care doctors, and only the primary care doctors typically will be sampled. Being in a virtual group also helps you reduce what you have to do in improvement activity. Only 50% of the participants in a group have to report improvement activity. You will also have, obviously, the support of the VCMA and QVH systems, so you don't have to struggle through doing MIPS on your own. And finally, VCMA is anticipating starting a new ACO in 2021, and those folks who are in the virtual group will likely be at least the nucleus of the doctors who form the new ACO. So to the extent that you have other doctors that are in your referral network, you would do well to get them to join the virtual group. because as many of you know, in order to get the 5% bonus for the ACO, you have to have at least half of your patients, half of your Medicare fee-for-service patients being referred through people who are participating in the ACO. And finally, remember that MIPS is just getting harder and harder. And we'll talk about that some today, but by next year, by 2021, the threshold will have increased to at least 60 points. That means you'll have to get 60 points just to avoid a penalty. And obviously, the cost category is also increasing in importance. So how do you join the virtual group? Well, basically, you just need to read and agree to the terms of the participant agreement and get it back to Mary. If you don't have a copy of that agreement, Mary Carr will be happy to email you a copy. You need to just complete and sign the agreement. Make sure that your practice name is exactly the same as it appears in PACOS. And actually, if you can just attach a PACOS screenshot, that is by far the best way to ensure that your application can be processed properly. And then complete the Schedule A with the names and NPIs of all the MIPS eligible clinicians who bill through your TIN. And at this point, that's a lot of different types of clinicians, including MDs, DOs, physician assistants, nurse practitioners, dentists, podiatrists, optometrists, chiropractors, CRNAs, physical therapists, occupational therapists, speech-language pathology therapists, clinical psychologists, audiologists, and registered dietitians or other nutritional professionals. If any of those folks bill through your TIN under their name, then they need to be included on Schedule A. And as noted before, you can't have more than 10 people. So if by the time you count up all those folks, you're over 10, then unfortunately you would not be eligible for the virtual group. Once you've completed the paperwork, then you need to get that to Mary as soon as possible. And with that, you need to include your check to cover the participation fees. The fee is $599 each for the primary care practitioners, which includes anybody who is potentially going to be sampled for the web interface. So that also includes the nurse practitioners and physician assistants and specialists who act as primary care doctors for some of their patients, such as pulmonologists or endocrinologists or anybody else who has been sampled in the past under the web interface. And then if you are a specialist who will not be sampled and thus will have no work under the program, then you need to pay $999, and that's just to balance out the pricing versus the burden that's imposed. Okay, so what are your obligations in the virtual group? They're basically the same as your obligations were for the ACO. You're going to need to maximize your web interface performance. You need to maximize your promoting interoperability performance, which includes now having a 2015 certified EHR and a functioning patient portal. And finally, you would have to maximize your improvement activity performance, and I'll talk about that in a moment. Okay, so what if you don't go with the virtual group? Well, you need to understand that MIPS is getting harder and harder. So for the 2020 performance year, the penalty for doing nothing is going to increase from 7%, which is what it was in 2019, to 9% for 2020. In addition, the threshold for avoiding a penalty is going to move from 30 points to 45 points. The threshold for getting into the exceptional performance arena, where you get access to that extra $500 million of revenue, that is going to increase from 75 to 85 points. And as far as quality reporting goes, that is going to move from 60% of your patients, regardless of payer, to 70% of your patients, regardless of payer. The cost arena will still be 15% of your MIP score, and for most doctors, that will be at least those first two categories, the total per capita cost and the Medicare spending per beneficiary. The total per capita cost will apply if you have at least 20 patients. The Medicare spending per beneficiary will apply if you have at least 35 patients. Beyond that, all of those others only apply if you have at least 10 or potentially 20 cases. So for many of you, you will not have any of these. So if you never do a colonoscopy, then you're not going to be subject to the colonoscopy cost measure. If you never treat pneumonia in hospitalized patients, then you will never be subject to that. If you don't perform knee arthroplasty, then you won't be subject to that one, and so on. And for 2020, they've actually expanded this by quite a bit. These are all new measures for 2020, but they remain the same basic test. If you don't have at least 10 or 20 cases, as indicated there, of those matters, then you would not be subject to that particular cost measure. How do you do well on the cost category? Well, you basically try to practice as efficiently as you can. You know, the same things that you were doing in the ACO, for those of you who were in an ACO, trying to provide care at the most effective place, trying to use the most efficient referral sources, trying to avoid unnecessary hospitalizations or SNF days or home health days, increasing medication adherence and patient engagement, and maximizing prevention. You do need to continue to learn about how Medicare adjusts costs based on the risks that patients have, and that pretty much comes down to ICD coding. The next category is promoting interoperability. That will be 25% of your score. That does not change much from the 2019 requirements, which are that you must score at least 1 point in every category in order to get any score at all. And these scores are almost all percentage scores. So, for example, e-prescribing, you can get up to 10 points. To get 10 points, you would have to e-prescribe 100% of the time. If you e-prescribe 50% of the time, then you would get 5 points. Similarly, providing patient access, that is letting people have access to their information on your patient portal. Again, if 100% of your patients have the ability to access the patient portal, then you would get 40 points. If half of them have it, then that would be 20 points. And at this point, they don't have to actually access it, but they have to be able to automatically log on and get their information without having to contact you. Sending and receiving health information, that's worth up to another 40 points. You can get exceptions from those if you either send or receive, if you have a reason to either send or receive information less than 100 times during the year. So if you never refer patients out, or you never receive referrals, then you don't have to do that. But for the most part, most physicians are subject to those. You also would have to either report to or be exempt from 2 public health registries. So if you are not eligible for the immunization registry because you don't do immunizations, then that makes you exempt from that registry, and then you would just have to be signed up with a different one. There will also be 5 bonus points available for 2020, and that will be for querying the PDMP through your EHR. Many of you do that, and so you would potentially get that 5 bonus points. In any event, if you have not got a 2015 certified EHR fully operational in your practice, that is an absolute requirement at this point. You have to complete the annual HIPAA, and it is annual HIPAA security risk assessment. You need to make sure that all of your patient portal is fully implemented, and then you do your best to get 100 points for performance, meaning that you report on all required measures. You do your best to do each of them as often as possible. And again, for 2020, this will be a requirement to do this for at least 90 consecutive days. As far as the 2 public health registries, here's a slide that shows you how you can be exempt. As a practical matter, really the only one that doctors are typically exempt from is the immunization portal for those who don't do immunization. But pretty much all of these others are available to virtually any physician, or there are options that are available to any physician. One that the VCMA has been promoting is the Smokers Hotline. That's because that is easy and free, and Mary has the information to help you sign up for that. And also, the VCMA supports the Advanced Directive Registry, and Mary can give you information about that. Okay, as far as the web interface for 2020 is almost identical to the web interface for 2019. It's still 8 counted measures and 2 measures that are not counted. To maximize your score, you obviously need to understand what those are. And if you haven't yet got a process for getting your patients to annual wellness visits, that is a fantastic way to help achieve the goal as far as high quality scores. And there's lots of information on the ACE portal that is relevant to that. I guess the only other thing I'll say right now is that it is critical that the action actually be completed. So it's not enough to refer a patient for a colonoscopy. You have to be able to document that they actually got the colonoscopy. The exclusions for 2020 are the same as for 2019. Anybody who dies or goes on hospice or switches in or out of a Medicare Advantage plan or who moves out of the country is not eligible. The only changes to the measures are really to increase the patient exclusion. So for several measures, as is indicated there, folks who reside in an institution or who are frail and either receiving medication for dementia or suffering from an advanced illness are going to be excluded from these measures since it really doesn't make sense for them. Also, if you do administer flu vaccines and you use the live attenuated influenza vaccine, that is no longer an accepted vaccine for the measure. So if that's what you're doing, you would have to be able to show that either there were specific reasons why the patient needed that as opposed to a different type, or as a practical matter, you were in a situation where that was the only vaccine that was available to you. As far as reducing the burden, we continue to recommend that you work something out to do routine CCDA uploads. We are increasingly trying to increase the number of people that are using some type of API interface with us so that there's actually an automatic upload of the information. If your EHR supports the ECQM measures that are basically the analogs of the web interface, that is fantastic because you'll be able to track where you're at within your own EHR. Certainly, lots of the measures can be delegated to your medical assistants or others, and you should take advantage of that. And we've already talked about implementing the routine annual wellness visits. In fact, of the 10 quality measures, 9 have associated Medicare-covered preventive services that may be appropriately provided during the annual wellness visit. And those are almost always win-win, meaning that it's going to increase your payment, increase your quality, and not cost the patients anything. And there's a list of the many tools that are available on the ACE portal to help you. And here's just more about how you do an annual wellness visit. We can certainly do a seminar on that if that would be helpful to folks. We also do have the Advanced Integrated Registry and the ACE portal available for all web interface participants. For all virtual group participants. So you will have those tools to support you. And so finally, what do? Ask Mary for an application. Deliver the completed paperwork and payment to Mary as soon as you can. The absolute deadline is Monday, December 23rd. But Mary really can't be swamped with all the applications on the last day. And as you know, everything gets more and more difficult as we get closer and closer to Christmas and the other holidays. So the sooner you can get this paperwork signed and into Mary, the better. Again, as I mentioned, if you have questions, please feel free to email me, and I will do my best to get back to you quickly. Thank you so much.